If you're out there struggling with knee pain and you're looking for a natural solution and you want to avoid injections, medications, and surgery, this is going to be the episode for you. I've spent 16 years of my life studying how the body moves. And so that includes bones and joints and nerves and muscles and all the things and biomechanics. So I want to simplify all that and just really describe to you what the knee is designed to do. A joint really is two bones that come together to create a space, and that space is designed for movement. Joints in the body like to do certain movements, and they don't like to do other movements. And usually what they don't do very much of is what they don't like to do. The knee, first of all, it can bend and extend. So you're familiar with that. It does a lot of that. About 140 degrees of bending and extending. I would say that means that it likes to do that. It's very comfortable bending and extending. Now, the second thing the knee can do, is designed to do, is to move side to side. The knee can move side to side about 15 to 20 degrees, depending on the type of person. But again, now that's much less than the knee bending and extending, right? 140 degrees versus 15 to 20 degrees. Maybe even 25 in some people. But now it doesn't like to do that as much, but it can do enough. And now the third thing the knee can do is it can rotate in and out. All right? Now it can rotate in and out, but only 5 degrees. Okay, so now that's right there. That's a red flag. That means that if it can only rotate 5 degrees, then we know that it doesn't like to do that very much. The knee is two bones that come together. So it is the femur, which comes from the hip, and it's also the lower leg bone called the tibia, which comes from the foot and ankle. Now, it's important to recognize they can't move, they have to move together. They are interconnected. So what the lower leg bone does, the upper leg bone has to do. The foot and ankle influence the knee, make the knee move, as well as the hip. The hip joint as well has to influence the knee. So if I've got somebody struggling with knee pain, I'm always going to look and assess how well the foot and ankle is moving and how well the hip is moving. I like to use a phrase that describes the knee as stuck in the middle with nowhere to go. It's stuck in the middle of the foot and ankle and the hip. The body is designed to heal itself naturally, but you have to create the right environment. The right environment needs to include sleep, nutrition, and also the physical environment. The physical environment needs to be healthy so that it's not damaging the knee constantly. So really that's what we're talking about today, is the physical environment. So in this segment, I want to kind of hit quickly on the two most common names or diagnoses of knee pain, so that you can kind of understand and maybe put yourself in one of those categories. By far, the two most common names are, number one is osteoarthritis, okay? Arthritis, maybe it also has names called joint space narrowing or joint degeneration. Cartilage wearing out, bone on bone is one I hear a lot. And really, what does that mean? So arthritis of the knee or the joints and the bones, it's really a natural aging process. And in the next segment, we're actually going to talk about two studies, one particularly that basically shows that it's pretty hard to find anybody over the age of 50 without arthritis in their knee. Now the question is whether or not they have pain. I don't want to ruin it for us too early here, but stay tuned to the next segment. But really, arthritis is essentially the aging of the bone. So think of your skin, right? Your skin at 25 and then your skin at 75, right? The skin changes, it becomes a little bit wrinkly, maybe not so thick, a little bit more sensitive. And the idea is the same things are happening with our bones. And so it's important to recognize that it is really natural aging. The bone changes, the joint space does narrow. The joint space narrows in all of our joints, by the way, as we age. It's the reason why we shrink, most commonly in the spine. Our spine is actually losing joint space in the disc area. And so it's happening all over our body. But by far the most common diagnosis of knee pain is arthritis. Now we'll get to that in a minute. Later on, what do we do about it, right? Can you live without arthritis pain? Yes, you can. And now the second most common name or diagnosis of knee pain is what's called a meniscus tear. And as you can see in this image here, a meniscus is this little, as the bones come together to create that joint space, a meniscus is this little, almost like a cartilage ring that goes around the knee joint. And really the point of the meniscus is to make it so that the knee joint itself is more congruent or maybe more stable, so that the knee joint is maybe held together better. Some people like to refer to the meniscus as a shock absorber. I would say that there's not a lot of evidence to support that. In fact, there's a lot of evidence to support that the knee joints themselves the bones aren't actually touching. There's space in between those bones, and that's a good thing. There isn't a structure on the earth that can be slammed into each other 10,000 times a day like you do when you're walking with about 1,000 pounds of force that wouldn't be completely destroyed. So our bones don't touch, there's a space in between, and it's our muscles and our soft tissues' job to keep that joint space open and transmit the energy elsewhere. So you've got two types, osteoarthritis and a meniscus tear. Now, again, next segment we're going to talk about the meniscus tear and does that equal pain? And there's different grades of meniscus tears, and I can say that it's natural for us to have some minor tearing. On the other end of the spectrum, we can have a meniscus tear that's so bad that it actually gets inside the joint and stops the knee from moving, where it locks up. In those cases, that is definitely a surgical situation where the knee is locked up and cannot move. For everybody else, there's a lot of hope. You just learned about the two most common types, which are osteoarthritis and meniscus tears. And now I want to kind of talk to you about how those are probably not the cause of your pain. And so let's start out with the studies that I have. I have two studies that look at both of those conditions. So osteoarthritis, first of all, we have a study that was called an asymptomatic imaging study, which means that they looked at thousands of people that are having no knee pain, and they gave them an MRI for their knee, and what they found was pretty fascinating. 76% of people over the age of 63 have evidence of osteoarthritis in their knees in this study, but only 13% of those people reported having pain. So what does that mean? Well, that you have to come to the conclusion then that osteoarthritis is not a direct correlation or causation or cause of pain. And so we're going to get to what the causes are in a second. Now, a second study looking at meniscus tears was a systematic review and published by the British Medical Journal. And what they came to the conclusion is that they looked at people that had surgery for their meniscus, an arthroscopic surgery for the meniscus, and then people that went through physical therapy. And what they found was that there was no difference between the two groups. So the recommendation after reading that study from the BMJ, or the British Medical Journal, in 2017 is that people should not have surgery for a meniscus tear. They should go to physical therapy. You can find all these studies published on our website, and so if you want to go check that out at thesuperiortherapy.com, you're more than welcome to read all you want. I love reading studies because they help us understand better what's changing in the world of medicine, particularly in this case. So really that leads us to the next question of, okay, if I have arthritis or if I have a meniscus tear, which basically gives us 90% of the people out there dealing with knee pain, what's the real cause of my pain? If these studies indicate that it's not those two things. So let's dive deep into what causes knee pain. Remember earlier I talked about how the knee is stuck in the middle with nowhere to go. It's stuck in the middle of the foot and the hip, okay? So the motion that the foot and ankle does affects the knee, and the motion that the hip does affects the knee. When we're walking and our foot hits the ground, that the foot flattens out like a pancake. The foot flattens out, it grabs the lower leg bone, and it turns it inward, 30 degrees. Now, that lower leg bone goes up to the knee and says to the knee, hey knee, you gotta turn in 30 degrees. And the knee says, wait a minute, I can only do 5 degrees. But good thing, I've got the hip upstairs, and I can grab onto the femur and tell the femur to turn in. The hip is designed to move in 60 degrees. So now that's a good thing for the knee. And now that's a scenario where everybody's doing what they're supposed to do. It's really common for us in the sitting culture that we're in, sitting for 10 hours a day on average, that the hips start to get a little stiff. Now imagine if the hip doesn't turn in and the foot hits the ground, flattens out like a pancake, grabs onto the lower leg bone, turns the lower leg bone in, and the knee says, well, I can only do 5 degrees of that, 30 degrees. Hip, can you turn in? And the hip says no. Now you've got a knee that's forced to rotate more than it's designed to rotate. And that is a classic example of how the knee can be painful, right? The knee can be painful, but the real cause is actually because the hip is not moving properly. If you're in that scenario and your knee's hurting you, the first thing you're going to do is go to the doctor and ask to get help, right? And what commonly happens is we get an image, an x-ray or an MRI that then tells us we have arthritis. And that can be very misleading because we first need to look at the foot and ankle and the hip to see if they're helping out the knee. And that is the recommendation that I have for you. Get your foot and your hip looked at first before you go down the path of picking on the knee. It's usually not the knee's fault. Quick, easy strategies to improve motion in the two most common problems that affect the foot and the hip. Let's start with the foot. I'm going to stretch my calf muscle. That's the most common muscle that gets limited in the foot and ankle. I'm going to put my hands up on the wall. This is the focus back here. We're going to get a nice stretch in the back of that calf. I want a foot that's flat and straight. I want a knee that's straight. Put my hands on the wall and I'm going to gently let my hips move front to back, 30 seconds, then side to side for 30 seconds with my hips, and then rotate left and right with my hips. I'm going to do that on both sides. Then I'm going to use this chair to work on the most common problem in my hips that causes knee pain, tightness in the inner thigh. That happens from sitting a lot. We're going to use this chair. One foot's facing you, one foot's facing the chair. I'm going to stay nice and tall. I'm going to hold on to something. I don't want to be risking my fall or my balance with bad balance. So hold on to a stairway. Maybe you're in a stairway or in a doorway. I'm going to 90-degree angle my feet. My knee is straight. I'm going to drive my hips towards the chair for about 30 seconds. Right away, I feel a nice, gentle stretch in the inside groin. 30 seconds towards the chair, then 15 seconds around counterclockwise, and then 15 seconds clockwise. I would then try the other side for another minute, a couple times a day, a couple weeks. I should start to notice some natural knee pain relief. Welcome back to Pain-Free Living. My name is Dr. Andrew Grecki, and we're at the conclusion of today's show on knee pain. I want to summarize and recap what we've learned today. So you're smarter now than you were a half hour ago, which is pretty cool and makes me excited to help people heal naturally. So you know that the two most common types of knee pain are osteoarthritis and meniscus tears. You know that the studies indicate that those are not the cause of pain because there's a lot of people that have them without pain. You know that the common causes of knee pain are actually from the areas above and below, the hip and the foot. And you also now learned a few quick tips from me, so you can hopefully start to get on the path of natural healing. So if you're out there struggling with knee pain, you're looking for a natural solution, don't wait. You don't have to suffer. Give us a call. At Superior Physical Therapy, we have knee pain experts waiting to help you. 231-421-9300. And stay tuned next week. We're going to be talking about more common painful issues that people are dealing with that's preventing them from living pain-free.